Good morning, ladies and gentlemen. Jawa has done the introduction. The objectives of this particular workshop is to be able to step down the training with the skills and experiences they acquired while they went abroad for a workshop. So in the drive, for the management's drive to carry everybody along, even the states were asked to join this particular training online. So I will introduce the first group. They're actually a team, but a lot of them have other official engagements. I'm introducing Mrs. Sarah Atta, who is going to present on an international conference on planning, research, and statistics. So please, let's put our hands together for her. We are going to ask questions later, so it will not just be a presentation where she will just sit down. It will be interactive, and questions will be asked later. So please, let's put our hands together for her. Thank you very much.
Okay. Good morning, directors. Good morning, CTA. Good morning, other management staff. Thank you, sir. Good morning, CTA. Good morning, directors. Good morning, management staff and senior colleagues and my colleagues. So I'll be taking the presentation International on Planning, Research, and Statistics. So this training was attended by the DG, Planning, Research, and Statistics, and Mr. Awasan Suleiman, Philip Osong, and myself, Sarah Atta. So the outline of the presentation is as follows. I'll begin with the introduction. Then I would take us through the definition of research, the research workflow, research methods, which are broken into quantitative and qualitative. Then we'll go into a brief introduction to SPSS, introduction to in vivo, and then a conclusion. So no matter what career field you're in or how high up you are, there's always more to learn. Research unlocks the unknown, lets you explore the world from different perspectives, and fuels a deeper understanding. Planning is essential to the success of any research project. A research plan identifies and helps define your focus, method, and goals, while also outlining the research project from start to finish. So basically, we're taught that research is very important in anything we're doing, and that's why this course was very, very important. So what is research? Research is an organized, systematic, data-based, critical, scientific inquiry or investigation into a specific problem, undertaken with the objective of finding answers or solutions to it. So whatever problem that we want to study further, it's research, no matter how you want to look at it. When you have a problem statement and then you want to study it further, that's research that you're doing in a nutshell. So research is what we do when we have a question or a problem we want to resolve. We may already think we know the answer to our question. We may think the answer is obvious, common sense even, but until we have subjected our problem to rigorous scientific scrutiny, our knowledge remains little more than guesswork, or at best, intuition. So research is subjecting the problem that we want to study to rigorous scientific scrutiny. When we haven't done this, then it's only when we've subjected our problem to rigorous scientific scrutiny that we can say that we have carried out research. The first priority when we are conducting research is to formulate your question. Then you figure out how you're going to answer it. So in research, you don't necessarily have to always reinvent the wheel. You can look at what others have done, how others have answered this particular question in the past and follow that method. So you can look at how others have answered it, you can look at how the proposal fits in with what others have done and how you will know when you have answered it. It is very, very important to plan properly before you begin your research, because research can be very broad and it's easy to go out of line. But when you plan properly, you stick within the scope of your research, then you can present your answer. Research workflow. Research workflow defines the step-by-step flow for your research, and it keeps you organized. Like I mentioned in the previous slide, it is very easy to go out of scope when conducting research if you don't plan appropriately and you're not very organized. So it's important to follow the research workflow so that you would be very organized and you can go step by step and you don't go out of scope. So first of all, you observe a broad area of research interests that you want to go into. So like we said previously, whatever problem you want to research on or area, you first of all make observations, then you gather preliminary data. It can be through interviewing, literature surveys, literature reviews, just preliminary data before you go into the research proper, just to have an idea of what you're getting into. Then you define the problem. After you define the problem, you look at the theoretical framework, which clearly identifies and labels variables that you're going to be using for the research. Then you generate a hypothesis, and then you do scientific research. After that, you collect, so scientific research, which is data collection, analysis, and interpretation. Then you deduce your answer from this scientific research that you have designed, and your answer will tell you if your hypothesis has been substantiated or not. So the first step we looked at is finding the research problem. We can find the research problem through literature review, through library websites, through class discussions, through discussions with colleagues and peers, and the likes. Then defining problem statements. A problem statement is a short, clear explanation of an issue or challenge that sums up what you want to change. It helps you, team members, and other stakeholders to focus on the problem, why it's important, and who it impacts. So, like has been mentioned previously, it's very important to define your problem statement, because that will help you to keep your research in scope. It will help you to, because it's very easy to go overboard. So when you clearly define your problem statement and define what variables you'll be using and how you'll be going about your research, you would stick to the goals of your research. What is hypothesis? A hypothesis is a prediction of a relationship between one or more factors and the problem under study that can be tested. Hypothesis can take various forms depending on the question being asked and the type of study being conducted. A key feature of all hypotheses is that each must make a prediction. These predictions are then tested by gathering and analyzing data, and the hypothesis can either be supported or refuted on the basis of the data. So after we identify our research problem, we predict the hypothesis from the research problem. And then it is after we have carried out the scientific scrutiny and analysis that we would be able to answer if our prediction of the hypothesis has been substantiated or not. So characteristics of hypothesis. It's a declarative statement that identifies the predicted relationship between two or more variables. It is, so a hypothesis must be testable, and then it must be based on sound scientific theory and rationale. So we cannot pick a hypothesis that cannot be tested. Then that way there's no way we can either substantiate or not our hypothesis. So it's very important that these two characteristics are kept in mind when we are predicting a hypothesis. So types of hypotheses. Two types of hypotheses with which you should be familiar with are the null hypothesis and the alternate or experimental hypothesis. The null hypothesis always predicts that there will be no differences between the groups being studied. By contrast, the alternate hypothesis predicts that there will be a difference between the groups. So for example, the null hypothesis will predict that the exercise group, so if, for instance, we're taking an exercise group, the null hypothesis will predict that the exercise group and the no exercise group will not differ significantly on levels of cholesterol. So there's no difference between the groups. However, the alternate hypothesis will predict that the two groups will differ significantly on cholesterol levels. So research objectives. It's important that you state what you want to achieve from your research, and you state your objectives in clear and concise manner before undertaking any research project. Types. So we have general objectives, which states what researchers expect to achieve by the study in general terms. And then we have specific objectives, which are smaller, logically connected parts of general objectives. They are the specific aspects of the topic that we want to study within the framework of our study. So the general objectives are more smaller and more broken down. So specific objectives should systematically address the various aspects of the problem. They should specify what we will do in our study, where and for what purpose. Why should research objectives be developed? Research objectives should be developed to focus the study, narrowing it down to essentials. So research objectives should be developed so that we can be able to focus on the goals of our research project and then not just go broadly into it. Research objectives should be developed to avoid the collection of data which are not strictly necessary for understanding and solving the problem we have identified, and to organize the study in clearly defined parts or phases. Properly formulated specific objectives will facilitate the development of our research methodology and will help to orient the collection, analysis, interpretation, and utilization of. So it's important to ensure that the objectives of your research study cover the different aspects of the problem and its contributing factors in a coherent way and in a logical sequence. So it's important that your objectives clearly terms, specifying exactly what you are going to do, where, and for what purpose. Your objectives are realistic, considering local conditions, and it's important that you use action verbs that are specific enough to be evaluated. Examples of action verbs are to determine, to compare, to verify, to calculate, to describe, and to establish. Avoid the use of vague non-action verbs such as to appreciate, to understand, or to study. So these will help us ensure that our research is kept in scope. So research methods. Ways in which research studies are designed and the procedures by which data are analyzed. Research and research methods. Research methods are split broadly into quantitative and qualitative methods. To depend on your research questions, your underlying philosophy of research, and your preferences and skills. So we'll briefly look at quantitative and qualitative research methods. Quantitative data is about quantities, numbers, while qualitative data is about the nature of the thing invested and tends to be words rather than numbers. Differences between primary. So primary data is the data that you collect yourself, maybe through surveys, through interviews, and the likes, while secondary data is data that is already existing. So it's important to be aware of research data management practices and archives of data sets, both in terms of downloading and uploading. So there are certain rules. I know in Nigeria, we don't really follow a lot of these things, but outside of Nigeria, there are certain rules regarding, data management, and we need to be very careful when we are using data that is not ours, so that we don't break any rules. So this just shows us some differences between qualitative and quantitative data. We have, so for types of questions, for qualitative data, which is more, deals with words, we do more of probing. While for quantitative data, there's limited probing because it's more numerical. So the questions are direct. There's hardly any need to probe. Then for the sample size for qualitative data, because of the nature of qualitative research, the sample size is usually small because more work is involved. So for instance, if you're doing like a focus qualitative research, there's only how much you can do because of the work involved. Then quantitative data is usually, the sample size is usually larger because it's easier to collect information and reach more people because the answers are more direct. Then information per respondent. For qualitative data, for qualitative research, the information per respondent is usually a lot, and it's usually a lot to process. While for quantitative,
so people speak fast.
Thank you. Okay, so for quantitative research, the information per respondent. Okay, well, for quantitative research, the information per respondent usually varies. Then for the administration required for qualitative research, it requires skilled researchers, while for quantitative research, the administration requires fewer specialists or skills because it's more direct. Then types of analysis for qualitative research, the analysis is usually subjective or interpretative, while for quantitative research, the analysis is usually statistical. Types of research for qualitative research, it's usually exploratory, while for quantitative research is usually descriptive or casual. So at this point, I don't know if we have any questions or okay, so choosing your approach. Your approach may be influenced by your colleagues' views, your organization's approach, your supervisor's beliefs, and your own experience. There is no right or wrong answer to choosing your research methods. Whatever approach you choose for your research, you need to consider 5 questions. So these 5 questions are very important when choosing your research approach. And it's important to note that there is no right or wrong manner. As long as you're able to achieve the objectives of your research, whatever approach you choose, it's up to you and based on your skills and the type of research you're trying to do. So the first question is, what is the unit of analysis? For example, country, company, or individual. The second question is, are you relying on universal theory or local knowledge? That is, will your results be generalizable and produce universally applicable results? Or are there local factors that will affect your results? So when you're conducting research, it's important to ask yourself before you go into the research, if the results you would obtain from this research you're trying to conduct would be, universally applicable worldwide, or will it only be applicable maybe in that local setting in which you're conducting the research? Then will theory or data come first? So should you read the literature first and then develop your theory, or will you gather your data and develop your theory from that? Then the next question you should ask yourself is, will your study be cross-sectional, or longitudinal. So will your study many subjects at the same time, or will it study different different participants over a period of time? So you need to know this before you begin your research. Then will you verify or falsify a theory? You cannot conclusively prove any theory. The best that you can do is find nothing that disproves it. It is therefore easier to formulate a theory that you can try to disprove, because you only need one wrong answer to do so. So quantitative approaches. Quantitative approaches attempt to explain phenomena by collecting and analyzing numerical data. So remember we said quantitative research has to do with numbers, while qualitative research has to do with words. Quantitative approaches tells you if there's a difference, but not why. Data collected are always numerical and analyzed using statistical methods. If there are no numbers involved, it's not quantitative. Some types of research lend themselves better to quantitative approaches than others. Data sources for quantitative data include surveys, when there are a large number of respondents, especially when you have used the Likert scale, observations, and secondary data. Analysis techniques include hypothesis testing, correlation, and cluster analysis. So analyzing quantitative data. It's always good to group and or visualize the data initially so that we can see what the data is saying, how the data is looking. We can see if there are any outliers, and then it's also important to clean the data before we begin proper analysis. We need to know what averages we're looking for. Are we looking for the mean? Are we looking for the median? Are we looking for the mode? We need to look at the spread of the data. We need to look at the range of the data, the lowest figures, the highest figures. Just look at what the data is saying before we actually get into analysis. We look at the variance and the standard deviation. So generally, there's either a difference between or within groups or a correlation. So when we are looking at data, we would be able to tell this from the data. Choosing the right test to use depends what sort of data you have and how it is distributed. It's important to note that correlation does not imply causation. So two variables can be correlated, but that does not mean that one of them causes the other, the other. So for example, we have some correlation here, some examples of correlation here. We have per capita cheese consumption correlates with number of people who died by becoming tangled in their bed sheets. So we can see that there's a correlation, but then we can't really tell that there's a causation between the two variables. And also we have number of people who drowned by falling into a pool correlates with films Nicolas Cage appeared in. We can see that there's a correlation, but we cannot tell, that there's causation between these variables. So what quantitative researchers worry about is my sample size big enough? Have I used the correct statistical test? Are my results generalizable? Are my results or methods or results reproducible? Am I measuring things the right way? What is wrong with quantitative research? Some things cannot be measured or measured accurately. It does not tell you why. Can be impersonal. No engagement with human behaviors or individuals. Data can be static. Snapshots of a point in time. Can tell a version of the truth or a lie. So qualitative research now. Qualitative research involves finding out what people think and how they feel, or at any rate, what they say they think and how they say they feel. This kind of information is subjective. It involves feelings and impressions rather than numbers. Qualitative approaches. Any research that does not involve numerical data is a qualitative approach. It uses words, pictures, photos, videos, audio recordings, field notes, generalities, people's own words. Qualitative approaches tend to start with a broad question rather than a specific hypothesis. Qualitative approaches develop theory rather than start with one. They're usually inductive rather than deductive. Gathering qualitative data tends to use data to explore how and why things happened. They don't need large sample sizes in comparison to quantitative research. Some issues may arise, such as respondents providing inaccurate or false information or saying what they think the researcher wants to hear. That's why we had said earlier that it's important to probe when trying to obtain qualitative data. Then ethical issues, researcher is usually closer to the participants. Researcher objectivity may be more difficult to achieve. Sources of qualitative data. We have interviews which can be structured, semi-structured, or unstructured, focus group discussions, questionnaires or surveys, secondary data, including diaries, self-reporting, written accounts of past events, archive data, and company reports. Direct observations may also be recorded. So direct observations, this may also be recorded by video or by audio. And then we have ethnography. So analyzing qualitative data. Qualitative data is content analysis, grounded analysis, social network analysis, discourse analysis, narrative analysis, conversation analysis, because since this is non-numerical, these are the ways we can analyze qualitative data. Examples of qualitative data research: describing and comparing two types of audio guides, person-led and technology-led. Geolocated audio to enable public informal learning of historical events. Data sources, we have questionnaires, research observations, and small focus groups. What qualitative researchers worry about? Have I coded my data correctly? Have I managed to capture the situation in a realistic manner? Have I described the context in sufficient detail? Have I managed to see the world through the eyes of my participants? Is my approach flexible and able to change? What is wrong with qualitative research? It can be very subjective. It can't always be repeated. It can't always be generalizable. It can't always give you definite answers in the ways that quantitative research can. It can be easier to carry out or hide. Bad, poor quality, qualitative research. It can be easier to carry out or hide bad qualitative research than bad quantitative research. Other aspects of research design. So when we are designing our research projects, it's important to ensure that it is valid, reliable, and trustworthy. So trustworthiness is broken down into dependability, which shows that the findings are consistent and could be repeated. Confirmability, which shows the degree of neutrality or the extent to which the findings of a study are shaped by the respondents and not researcher bias, motivation, or interest. Credibility, which shows confidence in the truth of the findings, and transferability, which shows that the findings have applicability in other contexts. So now we're just going to briefly look at two software, which are SPSS and NVivo, very briefly before we conclude with the presentation. So introduction to SPSS. SPSS is Statistical Product and Service Solution. That's what the acronym stands for. It's one of the complex functions and analysis with simple instructions. So SPSS is used mostly for quantitative data, and there are two different windows in SPSS. We have the data editor window, which shows data in two forms. We have the data view and the variable view. So this is where we have our inputs, which we're trying to analyze in the data view and the variable view. and we can look at the data in this data editor window and analyze our data. And then the output via window shows results of the data analysis. 3 basic analyses that can be carried out with SPSS. We can do frequencies, which produces frequency tables showing frequency counts and percentages of the values of individual variables. Then we can do descriptives. This shows the maximum, the minimum, the mean, and standard deviation of the variables. We have linear regression, which analyzes, estimates the coefficients of the linear equations. Then in vivo. So in vivo can be used to analyze qualitative data. So functionality, in vivo is a complex piece of software that is very helpful for organizing data in many different formats. Most commonly used for dealing with large amounts of unformatted text data. It allows you to bring together different files and file types into a single project and manage them as a coherent whole. In vivo has many tools to make working with qualitative data easier, but for most people, the core of doing qualitative research and the most time-consuming part is coding. Chunks of text, phrases, or sentences in interview data, for example, individual tweets, are tagged with descriptors that classify them according to some scheme. In vivo, these tags or descriptors are called nodes. Codes can be a priori, come up with a list of terms according to theory before analysis, or inductive. Terms emerge as you walk through your data. Nodes are also used to store cases, units of observations, e.g. people who responded to a survey. Qualitative analysis is generally an iterative process. You read through your data, applying codes, and discovering ideas. And when something new strikes you, you may find yourself going back to data you have already read through to look at your data with a new lens. Coding is the process of organizing your data to make it easier to discover things and make sense of it. It is an art, not a science. There is no one correct way to do it. One researcher might apply fine-grained descriptive codes and then group and condense codes into broad themes and use these themes to summarize what has been learned about the research question. Another might start with broad groupings and then delve into each of the broader groupings separately to see how different interview subjects conceptualize them. The most important part of qualitative analysis is what takes place in the researcher's head. Software can help make the process of coding, annotating, and keeping track of your data easier, but there is no way to automate the process of making it make sense. So we have looked at what research is. We have looked at the research workflow. We have looked at different methods of research, which are qualitative and quantitative. We have looked at some software packages which can be used to analyze data, namely SPSS for quantitative data and in vivo for qualitative data. And it's important to note that the type of research approach you choose will be determined by your research question and your skills or ability to utilize a certain approach. So long as you make an informed choice and can justify it, it should be fine. There are numerous methods, it's important to pick one or two and specialize in them while having a general idea of the others. Thank you. No, sir. I don't know.
Thank you very much. I think we should have another. Thank you very much for the presentation. We have another presentation, so we are going to opportunity for questions. maybe two on the floor, two online, and two on the screen. They will give this and move to the next presentation. Can we start from the floor? Let's start from the floor. Floor or online. Because when you big men talk, you're surprised. So please, any question from the floor? You should ask questions. Yes. So I have
CTA directors and colleagues. This is a yes, sir. Okay, this is an academic discourse, not just a presentation, because we went through all what is required in conducting the research. Just an observation. You can get research questions. When you get an idea and you want to research into it, it's very, very abstract. You develop concepts. From this concept, you operationalize it. When you operationalize it, the research question you get from here from your objective. This objective is what you are going to do on the field to search for those questions identified that are originated from your concept, which you operationalize. The operationalization of your concept is to clarify, to define, so that people that are not in that field can get a clear picture of what you are saying. That is number two. Then lastly, in the analysis, statistics, frequency, then regression analysis is part of the analysis under SPSS. So you mentioned correlation and differences, which you can go, it can be positive, it can be negative, it doesn't matter. But regression analysis is there, which is fixed on its own. Thank you.
Thank you, sir.
Thank you. I observed in your presentation when you talk about the SPSS, the meaning you told us was statistical products and solution cells, but that's not the correct meaning for SPSS. It is statistical packages for the social sciences. Thank you.
Thank you very much. Yeah, I will not involve for the respected mother. Good morning, my highly esteemed boss, the CTA, Dr. Collins Pio, Director Colleagues. I want to commence the presentation. If this was a presentation on the review of literature on planning, research, and statistics, I will be very satisfied, because that is what has been done. It's a strategic review of the literature on what those subjects entail. I do not see the input, contribution, or intake from the international conference in Istanbul. What did you learn in Istanbul? Everything here is online. I can just go 30 minutes. I'll present it online. All I have is just compare everything. Thank you. Number two, what was the theme of this conference? What are the objectives? What are the highlights? What was the communique? What explained was the way forward on this issue especially since the international conference is influenced by emerging issues on static research, planning, and statistics. I followed you because I was interested as a statistician and as a director of census. You discussed correlation. You will show me some correlation. What type of correlations did you display? There are several types of correlation. See the coefficient. What type of correlation were you discussing? You also talked about sources of data. You named all of them, but after talking about ethnography, which is under anthropology, you failed to discuss participant observation. Once anthropologically you talk about ethnography, you must state participant observation. Furthermore, your form of presentation was actually reading. You were just reading to us. These are professionals. These are technocrats. These are people from different fields. They want to see something different. They want to see what is your own perspective, your idea, your input, and your contribution. If I was a CTA, I would demand a representation of this paper, but I commend the work. Thank you very much.
Okay, thank you very much. Before I get to CTA, I think for the first time I'm aligning with my dear brother. Seriously, almost what he said is sausage. Apart from the fact that everyone mentioned this stuff, nobody knows where it is. I don't say exactly. No, I'm saying it's the intro. Thank you. Exactly. So we need beyond choice. We need beyond paper presentation. We can sit down and read this in our home. We want to share our experience. To understand how does this relate to the work we do with national preparation. Understand? So please, I'm still around the city to talk, but this is the top presentation. We forgive her for their mistake. Is that clear? But seriously, we're here for serious business. Even the working environment where you went to, we want to have an idea. Do we have the same working environment? How are we going to aspire to the same working environment? So you need to, for those that are presenting maybe so you have to come up with something practical. How do you practicalize this in our own work, in our work in the next one? So I'll give the CTA to make the final comments.
Protocol duly observed. My own is a recommendation to you that the Population Services Department has the mandate to archive all form of information, data, training, and what have you. So I think at the end of this session and all others, the department will get some copy and hard copy of all the trainings. Thank you.
Good morning.
Good morning.
You can hear me?
Yes, sir.
You're awake now? Because during Sarah's presentation, I noticed 3/4 of you were not writing anything. And 99% of those who are not writing anything. Sorry. 3/4 of you. 99% of those 3/4 of the quarter that were awake were not writing anything. How can you attend training? Go to school without pen and paper? This is understand that we young people, you put it on your phones, isn't it? Yeah? You write notes on your phone, you know. And when it is good to include that, let me tell you something that you probably know. That the brain makes a different connection with coordination at a different level the moment you begin to transfer things from the brain. It's very different. It's a very different mechanism when you type than when you have better connection. You will learn better. You can call me on but try for a change. The writing is what makes a difference. Think that in your own handwriting, not in the computer's handwriting. So that's why when you walk around, you can write a paper on your head and finish it there. Or you can write a new song for those of you who are artistic. But the moment you now sit down and you want to write down all that paper that you wrote in your head, it's like a completely different. Because then the logic is different. Okay, that's number one. Number two, this is supposed to be one of the most important, interesting, and exciting aspects of NPC work, research and planning. Because everything that you do at NPC, research and planning should be embedded. And if not, then no real. If I ask you to name anything that you do at NPC, that is substantive, where there is no room for research and planning, you probably won't name it. I'm not talking about the support services, I'm talking about technical substantive work. And that also, extends to what the support services provide. Research and planning is very key for the organization that deals with data generation and utilization and policy, because the two of them and the core engines are kind of part. Knowledge evolves, it's dynamic, it's changing. You have to know where knowledge comes from. You have to track it. You have to keep tabs on it. But you also have to use it to change direction when you need to change direction, because you always need to change direction. In other words, you need to keep what you're doing fresh, and you need to be well planned. So I was hoping that this was one presentation that we're going to take most interest in. I'm sure you do. Then the fourth general point is, I think it's already been mentioned by the previous speakers. What we are expecting from you, because you went to a workshop for training, and you need to come back and learn. Many organizations you have to do that within the first week of your more than 2 weeks. So when you go out, because you go to bring knowledge is useless when it is not shared. And I'm sure those of you sitting here learned about. I know Printer Pepper says that this is online. Yes, it is there. But even just taking the time or the initiative to go online and look for it is not as easy as it is assumed to be. So it's even good if somebody now brings it and then listen to it together. Instead of you going, somebody has gone and put it together, compiled it, synthesized it for better easier understanding. So yeah, so that's the positive part of it, okay? That you will know it's something that we can get, but when you go online, you're not going to get it in a condensed form like it. And I think that is still positive. So for me, I want to thank the presenter for doing that. But the point that I want to make is that in this forum, when you come from your training, is what is it that you went to do? Briefly. And what did you do? What did you learn? The takeaways. And more important, where is your plan for extending that or stepping that down to those who did? Because we can't take everybody to Istanbul. That's nice and fancy, but it's also very expensive. So if we take 4 of you there, we want you to come back and train the other 50 so that that knowledge is institutionalized. Because you went there to represent an institution, not yourself. So what I was saying, Sarah, is that you go over that briefly and then you give us a plan in terms of how you want to strengthen it up. How do you allow these people to understand that, and more importantly, to use it, because it was deemed relevant for the activities of NPC. So that for me is should be the biggest takeaway. Training. Tell us how you are going to. Are you going to divide this in groups? Are you going to go from place to place? Do you have a curriculum and so on and so on? So, so that's the general part, and I think that applies for everybody else who is coming to speak after you. I have some specifics because I do research on a living. I have stuff here, and I'm not going to take you through all that. I'm going to take you through topics. Okay? Just for this. Number one, the research methodology. And I think some of these have been said. You said a lot of things, and they are all right. But there are some specific things that, particularly for NPCs, we need, particularly because we are in the census season, and we just arrived from DHS. And research methodology, which drives both processes. And here I want to talk about particularly the emphasis on being methodical. Research is methodical. It is stepwise, because regression models that you mentioned are stepwise. The process is methodical. Don't follow the steps, you are not likely to arrive at the same results. And then extend that to how that applies to what we are doing now, Texas, and the surveys, and any other activities. They will see at the set to take assessment. Then there is the aspect of innovation. And in 2024, we can't talk about research without innovation. We have to talk about innovation, whether it is methodological innovation, or it's ideological innovation, or it's a technological innovation. Research and innovation go together. And I think that was missed, or it was not emphasized enough. Then there's a whole issue of literature review, which is an important component of research. You mentioned that issue, but it's on passing. Many people here apparently, if they haven't done research, they may not know the significance of that. And particularly in the era of social media, which has spoiled the party for everyone. We need to insist that when you are reviewing your literature and research, it has to be. So many people go to the internet. People here have asked people to do a few things for me, and then they go to the internet. Because I'm a social scientist, so I go to social media. I say, I think I've seen this somewhere. So it doesn't help you to that. So this is very, very important to also emphasize here that when we do research, sometimes material is not peer-reviewed because we discounted 20% verified because it's not verified. Okay, so this relates to ethical issues. This is what I'm saying. Talk about research and planning, and of course there's a planning ethical issues, and of course the whole issue of thinking outside the box. The conceptualization, the problem statement, and all that is outside the box first. And then you can start with the known, and then go outside the known, and so on and so forth. Not that we did, but I just wanted you to emphasize that a bit more. Then number two, this is also important for NPC, and I don't know how your workshop is. Right now, and particularly for those of us who are in the industry of data generation and utilization. We cannot ignore what we call big data. It seems to me that most of what you presented is based on the old-fashioned traditional data. And now we're talking big data. Instead of building statistical campuses or offices, we're building data science campuses. We're talking data science, big data. Sometimes when we say big data, people think like census is big data. No, census is not big data. Census is a large-scale statistical activity. It's not big data. Talk about big data, we talk about data that is inadvertently generated, not necessarily for statistics, but human activity. Like call data records. People are calling and you can track from where they're calling because the GPS is on the data field. So like analysis of call data records in relation to certain specific requirement policy issue. This is important. If you ignore that, this is a kind of data that you cannot find, but it's very, very important. And even in census now, we're using big data, we're using deadline measures. We're working with Greek, we're asking them to extract data that is highly correlated with settlements. And we can use this to produce high resolution population estimates, even for areas like in the northeast of Nigeria, where we cannot physically access and send delivery. This is big data. So the integration of big data into our official statistical activities is a key component of research that we should now be thinking about, not only that, but also working around NPC. Number 3. That's number 2. Number 3 is 2030 versus 2030. That's how we presented it, one versus the other. It was in Nigeria versus Cote d'Ivoire. That was different. But what about 2030 and 2030? You missed that. The power of the two. 2030, like you said, I'm mistaken. Snapshot. When you do the census, it's like freezing the population at a specific, at the census moment, taking a picture, whatever. But how about explaining why what's not on that picture is not on that picture? That's the power. Adding that explanation. So you shouldn't present it as one or the other. But there is a lot more benefit in the complementarity between the quantitative and the quantitative. Most people, like NPC, NBS, who deal with statistics, official statistics, they do know the quantitative aspect of statistics. So this is something that NPC really should also pursue. Number 4. I think this has been alluded to. This was really useful. But I want to advise you that when you start stepping it down, that you need to bring to life whatever it is that we presented, the other aspects of the site. Use NPC experience and practice. Otherwise, it remains theoretical. And as I was saying, something that you can Google and take on what you have to take. So what I was expecting to hear from you is that when you will describe the correlation, give some illustrations, examples. This is the work that we do. That it is not just mere text and grammar textbooks, but that there is direct application of these things to what we do here on a day-to-day basis at NPC. So that's gonna be done because the first one, which should have been my feeling, is the strategy for step down, the plan for how you're going to step down this knowledge going forward. Thank you very much, and well done.
Thank you, sir.
I think most of what you have is comments, but we only here to keep you as director, kind of rounding up.
Thank you. Thank you, sir. Thank you, sir. Thank you for all the comments and constructive criticism. So I'd like to say, okay, first of all, there was a question about how the conference, what we learned at the conference aligns with the work that we do at NPC. So the department's planning and research department, we carry out surveys and we do a lot of research. And then after these surveys, we usually write reports. So these skills that we learned from the training, particularly the use of the software analytical packages, will be helpful for us during the report writing phases of work. It will be helpful for the analysis of the M&E of the census. So I'd like to thank everybody once again, and would come up with a step-down plan and share it with the management as soon as possible. Thank you. It's off. Okay, it's off now.
Okay, thank you very much. Please, I'm trying to appeal for zero colleagues. It's an insult. If you cannot take my never take permission because waste our time. You understand? So work we can work out. Either come here and take permission or go to the director and take permission. I'll take it. Without wasting time, please, any presentation that is being done, if there are 3 people, not the person presenting, every member of that delegation takes ownership. So that means that you have to review the elements because they need to see it, they need to be it and accept that this is content present for us. So that we don't waste our time. From that point, I would like to introduce the next speaker. Good afternoon, ladies and gentlemen. We want to welcome the next
Thank you. All right, so and then some other partners. Broadly, the workshop was convened in response to the critical need for improving the quality and the reporting of mortality data across African and African countries and developing nations. So this was an Anglophone part of the training. It was also held for the Francophone countries. And then this is because we know that accurate and reliable mortality data is foundational for developing evidence-based healthcare policies and programs. The objectives of the training workshop was many and varied, but then we can distill it into the fact that it was to strengthen the capacities of countries in producing and collecting, analyzing mortality data for evidence-based decision making, but also to enhance the skills we dwell on this later on in the presentation, and then also to develop this development of statistics illustrating mortality levels and trends for policy review and planning. We had representatives from Anglophone countries in Africa, and it was Nigerian delegation was we had 4 members of the team, 1 person from the Bureau of Statistics, from the Primary Healthcare Development Agency, from National Population Commission, and then from the Federal Ministry of Health. So what's the focus of today's presentation? Briefly, I'll share key insights from the workshop. I'll also highlight crucial lessons learned, some of the key areas that stood out and also applies to the work we do here at the Commission. Now, I'll also outline some actionable steps based on this training. And then over the course of the presentation, in a small way, we also try to introduce fundamental concepts and tools that analysis to all of us. So we'll go through some exercises. We know you don't have all day, but then just some computations here and there, just for because these areas are what we do in the Commission, and we should be able to at least have an idea of some of the basic things that we can mention in meetings and the rest. So we look at mortality data and measures. We know there are 3 key determinants of population change. Can someone just shout it out? Different areas, different determinants of population change. Sorry? Birth? Yes, birth, yes. Deaths, migration. All right. And deaths. Thank you. So we know that that's one of the 3 determinants, and it's also an important one. Sometimes it doesn't get the important bets, because some people, they focus on bets, they're looking at the people coming into the population and then planning for them, but that is also very key because they are necessary for generating, also tracking some of the commitments that Nigeria has made to global commitments like the SDG. It also helps us understand. So the battery is. Thank you. It also helps us understand differentials in population health among different subgroups in the population. So the death rates in different subgroups, different areas can also help us understand some of the differentials in healthcare and the rest. So if there are areas where you are looking at spatial distribution of deaths by causes and the rest, and then you find out that most of the deaths through this cause is coming from slow place. Further analysis could show that maybe it's the healthcare being given, it's the infrastructure and the rest. So studying mortality levels and having this mortality data actually is key for this. And then also compare rates in one area with rates in another to compare rates over time. So if you have the data, you have mortality data, good mortality data, you can be able to look at some of these differentials that helps us understand what is going on in the population in terms of health. Like they say, death mortality data is really good. It also gives an understanding of the health of the population. It's also useful for projecting the future size of the population. We know for this from census, for example, that the mortality statistics is one of the key inputs when carrying out projections. And it's essential for, just reiterating what I've said, essential for understanding the health of the population. It also helps resource allocation. So like the example I gave, if the government wanted to, okay, there's so much coming out in terms of death data, distribution of causes from a particular area. It could also help the government know where to allocate its resources, buildings, and the rest. It's also critical for monitoring and evaluating health programs. Data mortality statistics is also important. It serves as an M&E. It could also serve as an M&E of the healthcare system, because it could help us check if some of the things that are being done in the population or some of the interventions are working or not. It also plays a role as early warning system. So in the outbreak of COVID-19, for those that were following some of the things that was going on in the data sphere, you could find out that data on COVID-19 was gold because of the nature of the disease, the circumstances, the dynamics. You found out that you needed to get as much data as you can to be able to predict what is going on, to be able to analyze, what is working, vaccines, and the rest. So this mortality data can serve as an early warning system, and also data from COVID-19 would have helped the global health system, local health system prepare for such pandemics in the future. It also contributes to global health metrics. So we said Nigeria is the signatory to some global commitments, and this data is good for that, including for the SDG. So briefly, sources of mortality data. Can we just shout it out? The ones we remember. Sources of mortality data. Anyone? Vital statistics, vital registration, civil registration, and vital statistics system. Yeah. Hospitals, health data, census. And then we also have surveys, like the verbal autopsy surveys, mortality surveys, and population censuses, and other sources, including police reports. So in some countries, when they are doing mortality data analysis, some of the records that I used are death records from pressings and the rest. Mortality data is difficult to get by, and the combination of sources such as some of the more non-prominent sources like police reports and the rest could help give a good picture of what is going on in the population. All right. So here we have some frequently used measures for mortality data. We have ratios, we have proportions, and then we have rates. Can someone tell us what the difference is between ratios and rates? Ratios and rates. We use it very often. Most of our reports use percentages, we use rates, we use ratios. So sir, well, sir, we have lots and lots of slides on lessons learned and actionable points. I could just skip to that if.
Just do your presentation, teach us what you learn, step it out, cascade it to us. That's what if the class is becoming too silent, and some people are dozing off, I don't think it's out of place for me.
Thank you very much. So I could stand here and teach us what. Thank you. Ratios. I talk about ratios and proportions and rates and the rest. But most of us here are learned and we know these things and we use them commonly. But the idea here is to be able to bring out some of the more salient points. But it's fine, sir. I'll continue. So for ratios, ratios compare basically two populations, occurrence of a variable in different populations. And the most common example that we use here is the maternal mortality ratio and then the maternal mortality rate. I would have loved to ask us what the difference between that is, but then, yes. It's fine. So for rates, for ratios, for mortality or maternal mortality ratios, that's what we mostly report. It shows the occurrence of maternal death per every live birth. So for that, the denominator is the number of live births in the population. However, for rates basically looks at the maternal deaths over time, and it's the difference I was asking earlier, just for note, is that the rates basically looks at most often when you're looking at rates, it's the subset of the population. So for maternal deaths, maternal mortality rates, you would say maternal rates, maternal deaths over the number of women within the reproductive age in the population. And frequently it is most of these rates are expressed are multiplied by some number, specific number, and also over time, like 1,000, because it makes it easier to understand. So you would hear something like the mortality rate for Nigeria is 39 per 1,000 live births. So in presenting rates that way, you are able to have a mental idea of what this would be, especially when it comes to numbers and numbers of people. So if we were to say, you know, the maternal mortality rate is 3%, you would find it difficult trying to at a snapshot being able to see how this stacks up against what's happening in the population. But 39 per 1,000 live births, and then telling you that for every 1,000 live births in Nigeria, you would expect 39 of those to die within 28 days of life. That is a striking thing that could help support policy. So this is why these are presented the way they are. And then some of the rates, when it comes to some of the specific measures, we have some of the mortality measures. We have the number of deaths, good death rates, age specific mortality rates, and the 5 stillbirth perinatal mortality rates, infant mortality rates, and then the maternal mortality rates. So for the number of deaths, this just expresses the number of deaths in the population. Maybe at a particular time, at a particular place group, say 105,000 people died in Nigeria in 2020, and then that wouldn't tell you, that wouldn't give you any actionable information, because you need to know, okay, is it how many people are there in Nigeria? You know, are there differentials among age groups and the rest? But then you can have the quick death rate. One of the most common one is the number of deaths in the population over the number of resident deaths in a year, and then the denominator is what the mid-period population is, either from the census or projection. And usually you take the mid-period population for this analysis because you'd like to capture some of the changes that may have occurred within the population for that particular year. Yeah, so this is why we use the mid-year population. And then if it's the mid-year, usually you use the population as at June 30. But if it's a multi-year period, you would use the middle of the year. So they are checking the good death rate for between 2015 to 2018. It probably take 2016, 2017 as a mid-year population to do that analysis. And then this is an example of the calculation for a country where you have the good death rate as 450, 445, and then the total population, multiply that. So could I ask them to do a quick multiplication for us? So we were supposed to get some numbers, and then I was supposed to say, hey, the person that says 7.8 is correct. And then the 7.8 is correct. So, but then that's data is the best practices when collecting, reporting data. Global best practice now is to ensure that your data is disaggregated by sex, by place, by age, and you would know that focusing on the total number of deaths will not give as much information. And then we would need to be more detailed, so including subnational levels, local governments, communities, and the rest. This can help make policies more targeted. We also have a specific mortality rate. So we mentioned that the true death rate just basically gave you the total number of deaths, and then over the total number of people in the population, and then times 1,000. And that information could be misleading, especially when you are trying to compare. So what usually happens is that you would need to find a specific mortality rates, what you say SM and MR, because it disaggregates the mortality rates by population, and then you can actually see what is going on. You could have a death rate of 10.2, and then find out that the death rate for maybe women reproductive 15 to 49 is, I don't know, 15 point something, and you know that, okay, that this is an issue, specific issues, or for children, you could have death rate for children being disproportionately high, and then you could target that. So this is why you would need to do this. I also had this little slide here where we had the death populations, and then we're supposed to work together to fill in these answers in red. So maybe when I share this, we could look at it together. Oh, we could look at it. Okay. Okay. So?
Is it a live data?
No. Yes, sir. It is a live data. This is the population for South Africa. Yes, I read them. Yeah. So you have for below 1, you have 58.81. The specific death rate for those below age 1, 56.81, and then all the way down to the 75 plus. What would be the most striking? Sorry? South Africa. Yes. Sorry? It has some water.
Less than 1 to 4, 5 to 14.
Yes, sir. So it's basically a snapshot. The other populations are not included. Yeah, yes, sir. So it's just an example of what we wanted to demonstrate here.
I will have come to wherever you tell us why is it that 6 from that one and drops down and also increases.
Okay, so
this is how it applies to our work.
Okay, sir.
So that people are collecting data, we know that the bad data should be set.
Okay.
So
I think that's a good point, sir. So when you look at the data, you do an analysis. One thing would be to look for patterns that are striking. And for this particular data, a pattern emerged. You could see for the a specific death rate for those under 1 is about 56, and then it starts going down, and then let's say it's increasing from 33, and you have the highest at 75 plus. I mean, those in the demography. I mean, if you dig further down, you could definitely find lots of country-specific factors that could influence this. But then, just by country glance, you could begin to make draw some conclusions. As you would expect that the age-specific death rate for those that are older would be higher in some instances, like I said. So if there are countries that have a good, very strong healthcare system, especially for seniors, maybe this pattern wouldn't show. But then for most countries, you would definitely see this increasing. And then, of course, for the one for under one is high. There are lots of focus on neonatal infants under 5 mortality, because it's understood that at this particular age, the baby's children are still vulnerable. The immune system are not very developed, and then so I mean, in some systems where the healthcare may not be top tier, you could expect to find a high mortality rate at that particular level. But then more if you delve further, you probably find some of the more nuanced reasons why this could be the reason. So if you were to have your data, you collect your mortality data, and then the death rate for those between 23 and 24 is 79 babies. On that one is really, really low, maybe 10, 12, especially in relation to the death rate for the country. And then for this is for 75 plus is lower. Then you also know from experience the healthcare service available in the country, the nature and the coverage. Then you begin to ask yourself some questions. Is it that the deaths for children are not being reported? Are the deaths for particular age group being over-reported, and and so on and so forth? I'm sure for Ukraine from 2021 or so, you'd find a very high mortality level, 18 and something, because of the war going on. So these are some of the things that you can look like when you're looking at the data, and can also give you a snapshot and an immediate idea of if your data is good or if you need to do something more to check it. So mortality in early life. This also applies to some of the work we do here. We trot out this statistics on neonatal death, infant mortality, stillbirths, under 5, and the rest. But then there are actually very specific definitions, global definitions of what counts as an under 5, and so on and so forth. This chart actually helps provide insight into this. We take stillbirth, for example. You see that stillbirth is the termination of pregnancy after 28 weeks of gestation, including babies born with no signs of life at all. Even in surveys, we see that this is classified sometimes because baby is born and then baby just breathes, or shaking or something, but then showed signs of life. But because the baby is dead and the mother didn't get to, we say it's stillbirth. But this is not so. Then you can also have, and then for miscarriages, this happens between conception and termination of pregnancy, between conception and then 27 weeks of pregnancy. So it's 28, 29, then you can term this as miscarriage, because, and this it's said because medically it is assumed that a fetus from 28 weeks of gestation is able to exist outside of the mother's system with care. But of course, as medical advances continue to grow, this can be this keeps being reviewed and refined. There is a very broad definition for this, and then a more narrower definition. Then you also have neonatal mortality. So for neonatal mortality, this encompasses miscarriages, stillbirth, and then death within each 28 days after birth, right? And then infant mortality is usually within 1 year of life, and then under 5, within 59 months. That is just before the child turns 5 in completed years. So this, when this is shared, you can look at it and get yourself acquainted with some of these definitions, because if you are somewhere and then you are expected that as someone working in National Population Commission, you understand some of these concepts. And even when you are reading the NDHS report and the rest, and also providing the data, the statistics at meetings that you are, should be able to understand, what infant mortality encapsulates, what perinatal mortality is, and fetal mortality and the rest. So live births, the more narrower, simple definition would be that it's any birth where there is signs of life, even if it's just for a second, for a few seconds, 1 minute or the rest, that birth is termed as a live birth. And then for stillbirth, like I mentioned, there is a broad WHO criteria, but then there's also a more narrower criteria which defines it. This is the one I mentioned, defines the stillbirth as a baby born with no signs of life at or after 28 weeks of gestational pregnancy. So from here on, I showed some examples of how these are computed. We see the end product of the statistics, but then this is what basically go on behind in the data set. We have for stillbirth the number of stillbirths, and then all of a number of live births within the calendar year. Perinatal mortality includes stillbirths and then early neonatal deaths. That's within 27 days of life, over the number of births during the calendar year. And always remember that it is reported by 1,000. Sometimes, like maybe you see SDG indicators, you'd see 339 or 3.9 or the rest. Always know that this is usually computed times as out of 1,000 live births. You have the neonatal maternity deaths, number of deaths in children, 28 days, less than 28 days, so that's up to 27 days times 1,000, all by number of live births. Infant mortality for children, deaths in children less than 1 year, and number of live births. Then there's an example here. Live births in 2006 was 365K, for example, and then mortality rate, the number of children deaths under 1 in that particular year was 3,882. You would simply just divide this and multiply it by 1,000. And whatever you have is going to be per 1,000 live births. In this example, it is 10.6 infant deaths per 1,000 live births. And the 5 mortality is the same, number of deaths in children, less than 5, by number of live births. And then child mortality for children 1 to 4 for the number of live births. And then the maternal mortality ratio I mentioned briefly earlier, the number of maternal deaths over the number of live births. So they shouldn't confuse these two, even though it's usually used interchangeably with maternal mortality rate. That actually measures something else entirely. And then we have this. And then we have for maternal mortality deaths. You would notice that it is computed out of the 100,000 live births. And this is because this event is rare. However, it is preventable and it is significant, especially when you apply it to the population. So you could see 312 maternal deaths per 100,000 live births. If you were to put this as a percentage or as a ratio, you would have something very little, 0 point something, I think. But then it would actually minimize the scale of this particular issue, especially because it's preventable. So usually it's presented this way to sort of give it, make it pronounced, and then also have dissemination to government for policies and the rest. And then for analysis tools, we have a tool called ANACO 3 by WHO. So this is a tool developed by WHO that sort of aids in analyzing mortality and cause of death. ANACO is short for analysis of causes of death. This is version 3. And what this takes as input is the line listing of deaths in the country. We don't have that in Nigeria. And we mentioned it briefly when we talk about verbal autopsies and data sources and the rest, and some of the lessons learned from the workshop. We don't have, so if we had a line listing, actual record of death, and then also the causes of death by using international classification of diseases, meaning it has actual globally standardized code for the causes of death. We plug that data set in here and then be able to get some information on your, the structure, you can check for completeness of the data set, but then also get other statistics on the specific death rates. And then what this does is that it provides a way for us to be able to compare these indices across country, because without the standardized way of looking at causes of death and the rest, we're not able to do that comparison. And currently, we don't have that data set, which is something that the Commission should look into. So I'm going to briefly go through the medical certification of the cause of death. The medical certification of cause of death is important when looking at mortality data statistics. I myself had only heard this in passing without even realizing that this was very crucial when it came to reporting mortality statistics. Okay, so the way you would keep a record of in a good mortality data generation system would proceed, in a simplistic form this way. There is a death occurs either at facility or in the community. The death is examined. Then there is a formulation of events leading to death. And this examination leads to identifying one specific cause of death. We fill in the details in the medical certificate of cause of death. And then we code the cause of death using a standard, which is here International Classification of Diseases. We have ICD-11 currently, but some countries are still using ICD-10. And then you code each of the conditions as reported in the medical certificate of cause of death. And this goes into the civil registration and vital statistics. System. This doesn't happen. I mean, some part of this happens in Nigeria, but critical links are missing. That we are expected that some of the work we do here at the Commission should be able to fill this. So I'm going to go through the slides because for the medical certification of cause of death, it is expected to be done by a trained medical personnel that could look at the sequence of symptoms, identify the cause of death. But for the purpose of, as part of the highlights of what we learned, we thought we should also share this. So for cause of death, for example, we define this as all those diseases, morbid conditions or injuries, which either resulted or contributed in death and circumstances surrounding them. And this does not include symptoms, signs, modes of dying, and the rest. We also have the underlying cause of death. So underlying cause of death is different. It's much more specific. It's the disease or injury that initiated the chain of events that led directly and inevitably to the cause of death. So several underlying causes of death can be attributed to death, but only one underlying cause should be identified and written down. And this usually the underlying cause of death, it's important in public health intervention because it shows that it is basically that, if that particular the intervention to address that particular underlying cause, then more often than not, you would be able to address deaths occurring from that particular area. And then you have the intermediary cause of death, which are some of the other conditions that precipitated the immediate cause of death, but occurs at the time between the underlying cause and then the immediate cause of death. The manner of death is different from the cause of death because this basically is a type, it's classification of death based on the type of conditions. And broadly, you have death due to natural causes and death due to unnatural causes. Deaths that are solely due to disease or the aging process are regarded as being natural in manner. So, and the reason why the cost of death is highlighted when it comes to mortality data generation and reporting is because, because it helps standardization across countries. So I mentioned the ICD codes. Without, there are some causes of death or misclassification of deaths that, if not reported, there is no classification for them because it's not an underlying cause. So aging, for example, you could hear that some of us knew we said that Queen Elizabeth died of aging, but that may not be the underlying cause. It could have been one of the National Population Commission would still not be able to produce this mortality statistics way it can be compared across other countries that are actually using standardized codes. So that's why we really highlighted the causes of death, manner of death, the distinction, so that this could be noted and taken into account when preparing the medical certification of cause of death. The medical certification of cause of death is the assignment of death caused by an authorized medical trained clinician who fully understands the clinical sequelae of disease or injury that leads to death. As I mentioned briefly, the medical certification of cause of death is an international standardized document that's supposed to provide a standardized measure of death, and this would help in generating these statistics. So this is what the form looks like. Okay, sir. All right. Thank you, John. So we have all of this medical certification of cause of death, but then perhaps in the step down, this could be, we could delve into this more so that we get knowledge. And then, so just to highlight that, as I mentioned, there are deaths occur either in the facilities or outside the facilities. For deaths within the facilities, you will expect that this is recorded in the medical certificate of cause of death. And then, that data comes out from the Ministry of Health to the National Population Commission, and then we use this to generate this. But then there are also deaths occurring outside the facility. In Nigeria, it is estimated that anywhere between 60% 75% of the deaths occur outside the facility. And in so doing, so even if occur outside the facility, and this is where the verbal autopsy comes in. Now, the verbal autopsy we have experience in conducting here in the commission. This is a validated community-based method of estimating cause of death using information obtained from the caretaker or the disease. So for those that did reversal in 2019, you saw that you were provided a standardized document that was taken to the communities, and then you were able to get a sequence of events occurring before the death, and then this was analyzed, and then we were able to get some measure of what is going on in the communities. So this is something that is a way that could be augmented with the recording of deaths in the facility. So I'm just going to skip through this, but basically the takeaway from the verbal autopsy is that the commission needs to try to find a way. We need to look at the way of embedding the VA system in the civil registration and vital statistics system. What we currently do is after the VA test is conducted, we get the deaths from the households, and then there's a follow-up survey, which is the VASA, and then we go. But however, that is just a sample, and that only takes the community deaths at a particular point in time. But if this is embedded into the CRVS system, where there is a system of notification of deaths from the community where it occurs, and then maybe from time to time, maybe every 6 months or 3 months, we take a sample, and then we go into the communities and get these causes of death, you would find that we would have a more complete mortality data. Because, like I said, if we depend on the deaths coming from the hospitals, we would be leaving out almost 75% of the deaths occurring in the country. So we need to put this in the CRVS system to be able to get something out of it. And the analysis of the data, you have two systems, expert algorithm, and then you also have the diffusion coded. So the diffusion coded, you have to actually looking at the sequence of death and then trying to find the underlying cause of death. For the expert algorithms, this is becoming very more common now. You have applications, algorithms that you feed data into. Then it spits out cause of death. Integration here, what I want to add is CRVS system. So that in harmonizing that system, we will be able to get a more cost-efficient and robust system that covers the entire. And then the challenges in the mortality system, we have proportion that's not registered, as I mentioned. The challenges. We have fragmented mortality data collection system. Many African countries, including Nigeria, face fragmented system for mortality data collection, with various entities collecting data. We have underreporting. We also see that we have a case of underreporting and inaccuracy. There is also limited coverage and reach. Even from our own system, we know from the 2018 DHS, the death registration was about 10% or thereabout. So we know that there's already a limited coverage that we currently have. We also learned that it's critical to enhance the CRVS system for comprehensive coverage. And this is to also ensure that we integrate data collection. Scaling of observable autopsy mentioned, I've mentioned that this is one of the things that we've seen that's sorely needed. We need routine VA data collection system in the country to help with the CRVS system. Training and capacity building for the people that will be carrying this out. We also need to strengthen data infrastructure and foster collaboration with stakeholders. We also need to strengthen leverage existing systems. There is currently a GIS2 system that collects data from death data from some sources in Nigeria, but this is not line listing, and also the coverage is not very good. So we could strengthen these systems. And then we also have within the population, we have a community level system where we collect beneficial data from traditional rulers where they keep records and all of that. We could also leverage on this system for mortality statistics collection. Capacity building, we need to first do a process mapping of the entire system, what is needed, what is missing, and then work on, and then also work on improving, and then also ask for trainings where it is needed. So what are the specific action points we could take away from this? So first, we need to conduct a detailed assessment of the system data collection system to identify integration opportunities and standardization leads aiming at unifying the system. So if data is coming from DHIS, we are also collecting data from the communities. We need to be able to know where the gaps are and how we can integrate. We also need to develop electronic death registration system, which we've already made tremendous improvement in terms of death registration. So we also need to do this for demonstration and then standardize and scale up paper autopsy system for using WHO guidelines. So others are more system-wide. This thing that's not under our controls, but for the first three, it's within the Commission's control and it's something that we can start working on as soon as possible. So thank you very much for your attention.
Thank you very much. It's a very, very detailed paper. I think we will not address all the issues today, but I've been listening to maybe people on the floor and people on this table, and then we can round up. We have another very important meeting at 2 o'clock, and we need to go. Thank you very much. So people on the floor.
No, sir. Who are we? All protocols clearly observed. I want to appreciate you for this knowledge you've shared with us. It's really a deep one, especially when you're talking about the medical certificate of course of it. Then I have a question and a contribution. My question is considering Nigeria presently, we do not have an accurate data, especially from our from our data gaps, because I know that in calculating all this, we have both direct and indirect methods of calculation. So is the indirect method integrated in this? Because I noticed that from all the calculations I'm seeing, they are looking at fully direct method, especially for those that have good data system. Then for rates, from your question on rate and ratio, in addition to what you said, for rates and ratio is the major difference is in their denominator. What do I mean by denominator? In the way when you are calculating from the same group of things, when you are trying to calculate something from maybe from a population and different data sets, different groups, the same data set rather, but different variables, that's when you use a ratio, because you are making it a ratio of this one to this one. So it is that is just the difference. But for rates, you are actually doing it in the same event, the same variable over a constant and over time. So I think that is just a layman's explanation of the differences between the rates and the ratio. Then for the when you were explaining something on infant mortality, I noticed that when you were asking, is that a table format for giving all this calculating the infant mortality or for showing the calculations, I will say that there is not actually a format, especially like there's no format itself, that standardized format that you can use in calculating. It depends on your level of interest and where your interest is. But it is very important for the less than one. Just like we said in the last training, the census training that was held a few days ago, last week, for mortality, it is always very important to focus on infant mortality, because there are a lot of things that happens there that you can have it divided for prenatal, for neonatal, because we need to understand what is actually going on in the the cause of mortality for this younger age. So it will enable us to plan for them. So it is focus is always there. So most times it is better when you have a standard of less than 1 first, then before you go to 1 to 4, because there are a whole lot of things to understand from less than 1 mortality. Thank you so much.
Yes, right.
Good afternoon, distinguished persons on the high table, my colleagues. I am happy that we have a presentation on mortality data. And from my experience, the weak link in our data system is mortality. And we know the basic reason for that is that is something that people don't want to talk about. In Nigeria, we continue to experience what the cycle called the crisis of invisibility. They die, and there's no record of them. And primarily because the data system are not able to capture their existence and their progression through life. From some of our studies, the conclusion that we came to on the issue of mortality data in Nigeria is what we call capacity latency. And what does it mean? The infrastructure is out there, the personnel is out there, but somehow they are not being utilized. And the problem is so fundamental. I remember some years ago, INEC asked us for mortality data to clean their voters register. And we couldn't. Why? Because forget about going to cause of death, that's the next level. It's easy to identify who died, when did they die, where did they die. And mortality data is so critical to so many things in people's lives that if not we will not be able to improve our health system, for instance, if we don't work on them. Yeah, because you're not being ingenious, you've not been innovative, in reaching out to the communities. Let me say this, some years ago, I took out some students, APS students, and we canvassed some communities somewhere in the country. We did 5 hours using an improvised surveillance instrument. We were able to get data on mortality. Of course, like we have in our CRM system, basic information on causes of death. And I think it's a challenge for us in the commission. One is one of our colleagues. One statutory instrument we use to make sure you don't register there. So, especially now that we are moving on to digitization, we want to find a way of incorporating some of the innovation that you talked about here into our civil registration system so that we can improve on our mortality data. Thank you.
Next, our presentation is very
Let me have my young prayer as well. So that two there, it's okay. So we have everything. So okay. My boss, colleagues, quite an improvement from the other paper. It's an attempt to tell us what the length, what the contributions were, and also to internalize it, but like the gentleman who raised the data did not come from the country. No matter how bad that data is, I know we have mortality data in Nigeria. We have mortality data in Nigeria. We captured mortality data census. We have mortality from NGHS, from Sentinel Survey, from this one. Also, we have several. We don't have data, or we still have the data. So please, in future, as much as possible, kindly make sure whatever you are doing, you use Nigeria, because this is where we are using them. Okay. Rates and ratio. Please, when you are doing a presentation like this, kindly give us the formulas. Your formula was basically calculated country based. We expect the formulas so that people can understand the logic behind the calculation. The presentation was skewed mainly towards health issues, but we are National Population Commission, and our mandate is what? So I expect that this presentation, as much as possible, you should try and tie it towards census. Also, I said the presentation was skewed towards health issue. If you listen to what he was saying, he was always saying in health related. Hey, so I expect that this should have come towards the census. We are getting up by census. And some of you will go out there and collect mortality data. Am I wrong? You will train on mortality data, you also gather mortality data. But in all, I think it's quite an improvement. And like the CTA said, for those of you coming to present tomorrow and next tomorrow, make sure that your presentation brings out what you truly learned and how that can be used to improve our Nigerian situation. Thank you.
Okay, before I hand over to the CT, seriously, we want to leave kind of legacy. Even if you are level 15 and 16, you are gone, but from level 15 downwards, seriously, you should have some kind of specialization in your department. We want to agree. There's a lot of feedback for the commission, but it only requires hard work of individuals. Assuming that we are successful in this digital vital registration adoption, I mean, you can have on analyzing mortality and unit in that department of vital registration, and it's a big ticket item. So I think there's a lot of resources out there for us to leverage on to improve the work we are doing, and will be held not locally but internationally. So I think from this presentation we can see that there's a lot to be learned. Exactly. And this forum is not going to do just that. So my appeal will be that this presentation is stepped down to the census data analysis unit. And I believe data administration, you have the analysis unit in BRB. What of census? Do you have analysis unit in BRB? Yes. Yeah. So there are people from census department who see that. So that's why you should call it department. So because it's not going to be everything, but I think this needs to be discussed in more detailed and more technical form, so that we can understand the nitty-gritty. And the data analysis unit of vital registration is key into that. We see that it comprises of all people working on data analysis, also key to that. So we need to talk on how to integrate this training and to ensure that this. And I said every person, especially those of you 14 and below, you cannot be on the fence. you have to be master of something or master of you are out of the commission. Because as where it's going, they will start qualifying you. What are you doing? You know, understand in your department or your unit, what are you contributing? If you don't have anything you're contributing, you know you're out. You understand? So, and they may not even use us to do this analysis. They'll hire governors for. I can tell you that the Nigerian workforce can go back by 10%. So even for your own interest, try to find some kind of skills that you are. We can say, okay, this is a master of data, this is a master of SPSS, this is a master of protection, this is a master of mortality analysis. So all these things we need to have. Thank you very much. I give the floor to CTF. Okay, come on. That's another lecture. Of your own.
No.
Give us that one.
I'll switch it off, sorry.
Thank you. I thank you, Philip, both for the presentation and the content of the presentation. I think very important. Don't be afraid. This is not going to be as long as the other one. I'm going to give you the brief version. It's another area where I do research, and there's so much we can share. And so much development with the analysis of mortality that includes the collection of data and so forth. So I agree with everyone who has said that you need to make this presentation to a census department, PID, planning research, and see that. Okay? Because it's also very technical area. Many students of demography run away from mortality because it's very, very complex. Even though that is straightforward, the analysis has become very complex. But you see, the point is that death is a significant event of life. So important that we cannot do without it. I don't know if you understand that. But people fear death because of stigma, because of what leads to it, and so on and so forth. So it's treated with a lot of privacy, a lot of confidentiality. It's stigmatized in some cases, depending on what are caused the death, so that people during a lot of declare the cause of death. People don't say exactly how somebody died because of fear of ridicule and stigmatization and so forth. That is very, very difficult. And without proper understanding of death, we give mortality its dues. And that is what I was thinking Philip would have done. I do understand that if the event was organized by ECA and UNICEF and WHO, then I do understand why the focus is on health and not on the demographic dimensions of mortality, which is completely missing from your presentation. And the reason is that in Africa, because of some of the things that I have mentioned, which tend to be very common to all African countries, the accurate measurement of mortality is invisible, to say the least, because it can get very complicated. It is from the point of data collection, both from the point of the respondent, giving you wrong information, either deliberately or otherwise. It's from the collector of that information. It's also from the person who is going to analyze information. So there are different levels of complexities. and all of them contribute to the inaccurate measurement of mortality data. But mortality, as I said, is so significant. That's why we cry when people die. It's painful. When something is painful, you can't ignore it. That's why I say we cannot ignore mortality when we discuss life. Because it's an important indicator of socioeconomic development and human welfare in general, health and welfare, even economic participation. Because some of the things that lead to mortality prevent you from doing certain things that sustain your life, what you call activities of daily living, and so on and so forth. So we want to make sure that whenever we have an opportunity to talk about mortality, we must measure it properly. And in Africa, the story is not complete without emphasis on indirect techniques for estimating mortality, because most countries, including Nigeria, have data paucity for measurement of mortality. Even your CRVS, the record of deaths and births and deaths, they exist in many countries. In fact, many countries have laws that you have to register a death before you can get a burial permit. But those records are haphazardly kept by the agencies of government or institutions that manage those records. And they are not analyzed. Even here at NPC, I know you collect CRVS data, but it is not analyzed demographically. It's analyzed for administrative purposes, right? Am I right? And this sort of thing. So my only point here is that when you get around to presenting this to Census Department and see that and PRP, you need to speak to the complexities around accurate measurement of mortality. Why is that not possible in Africa? And this is why most of the data that we give the world is distorted, because once you distort mortality data, everything else is distorted. Because mortality determines population age pattern. And as I said, participation rates in different areas and so on and so forth. Even if you just want to estimate the number of school-going children or the people in the labor force or the workforce, whatever it is, the disabled, you're talking mortality statistics. If you want to assess level of development, life expectancy at birth, or from any age to age of death, is all mortality. It's encrypted or embedded in every aspect of life going. So we need to make sure that we properly address the issues that impede accurate collection and generation overall of mortality data. Because if we do that, we'll be more than 50% closer being able to monitor and direct our policies on human and social welfare more properly than we are doing now. Census is a great opportunity to do that, because the census provides you with an environment or opportunities that DHS does not, including the measurement of maternal mortality ratio, because the error margin on that from DHS is too big to be ignored. But in the absence of any other better indicator, it goes, it works. But under normal circumstances, if you had done a census now, we'd have discarded that, because we'd have got a much better indicator. Because there are events, and the DHS sample frame or design cannot be able to accommodate proper measurement of rare events statistically speaking. So, I mean, there are all these issues. So I hope that you take care of this, which is basically for me, the interpretation and the furtherance of what you learn. So what you learned is like, you read the book. Now, how do you apply it to solve your real life problems? That should be the conversation. Thank you.
Thank you very much, CJ. So,
Thank you very much. I think the previous comment lists some of the points here raised on the indirect difficulty getting accurate mortality data, and also the need to also highlight the demographic dimension of the presentation. And these are all noted for the top-down training. And then just to add that, for in terms of the difficulties in capturing this is perennial, and we really need to look at innovative methods. So in essence, we would really need to see how we can get innovative in trying to address these gaps as so right. Okay. So thank you very much for the opportunity to. Thank you.
So we have come to the end of today's presentation. Tomorrow, by the grace of God, we'll start at exactly 10:30 a.m. I'm not going to waste 1 minute. So I want to thank the CTA. I want to thank most sincerely the directors here. I also want to thank the state directors and all those that join us online. So I want to thank most sincerely all the other management staff and staff that have participated in this. We believe that you're going to be useful for our work and also to increase of our knowledge. Thank you and have a nice day.
Please tell maintenance. Let them fix it.
Okay.
Let's try to hot environment, right?
Let's see how we